Hey, Afi.
Hey Zozo, how are you doing?
I'm okay. A little confused, though. You told me all about type 2 diabetes, but then what's type 1 diabetes?
That is confusing. Let me tell you a little bit about what it is. Type 1 diabetes is usually only found in children, unlike type 2, which can happen in older teenagers and adults. Can you remind me what diabetes even is, Zozo?
Yeah, it's when there's too much sugar in your body, right?
Exactly. Our blood sugar levels are super important. Sugar comes in many forms in our body. It's not just something that we bake with. In fact, when we eat foods, our body works really hard to break down this food so it can be used in different ways. Can you remind me how this works, Zozo?
Well, our food is kind of like a castle of blocks. Once we are done building our block castle, we have to break it up again to use the individual blocks for our next structure. Sugar is the same way, right? Our body breaks down our food into something called glucose.
Glucose. Exactly, Zozo. You can think of it like a block. In order to help your body use these blocks, or sugars, you need something called insulin. Insulin is something that your body sends to certain parts to tell it to let sugar in. This way, after you eat, all of the nutrients, all of the good things from your food can go into your cells and give them energy. Does that make sense, Zozo?
I think so. Insulin makes sure my cells get enough good things from the food I eat so that they don't starve.
Yeah, perfect. To learn a little more about where insulin comes from, check out the How the Pancreas Works video.
Okay, so what does this have to do with type 1 diabetes?
With type 1 diabetes, your body is not producing insulin. That is a problem because insulin is a super important signal. When our bodies don't produce it, we keep too much sugar in our blood, and then our cells don't get the energy that they need.
Okay, so type 1 diabetes means that there's no insulin, and so the body isn't able to get the energy it needs from sugar?
Right.
What happens when your cells in your body aren't getting the energy they need?
If your body is not able to use all of the energy it needs, it might act a little differently than you're used to. With type 1 diabetes, patients often are extremely thirsty, extremely hungry, they need to pee a lot, and they might lose weight. They also may even get blurry vision.
Oh no, are you okay if you have type 1 diabetes?
Yes, there are many treatments to help deal with type 1 diabetes. People with type 1 diabetes will often get an insulin pump or insulin injections so that their body gets the insulin that they need to use the energy. To learn more about both of these, check out the insulin pumps and insulin pen videos. It's also really important to eat healthy and exercise regularly.
Oh, cool. Is it contagious?
Nope, type 1 diabetes is a genetic condition. To learn more about what that is, check out the What's a Gene video. And if you want to learn more about the genetics of type 1 diabetes, check out the Genes and Type 1 Diabetes video.
Oh, okay, I will. Thanks, Afi.